And welcome back. Well, today we're going to talk about a remarkable transformation, but it's not the type of transformation that we often talk about here on the show. It's one woman's story about cataract surgery and the incredible way that it's changed her vision and her life.
Dr. Deborah Mangione is a thoracic and vascular surgeon. She's also the founding doctor of Wisconsin Vein Center MediSpa. She's a regular here on the Morning Blend. She is joined by Dr. Nicholas Bruns, who is the lead optometrist at Summit Eye Care of Wisconsin, where Dr. Mangione had her surgery. Good morning, guys.
Good morning. Good to have you both together.
I know. And usually when you're here, we talk about transformations that people have had in their skin and a lot of other veins.
And their body.
And their bodies.
Yes.
But today, this is about your vision. And I love that you brought Summit Eye Care to us because it sounds like they're doing some incredible work.
They are, indeed. You know, I think we are so fortunate in Milwaukee to have a team with the ophthalmologist, the surgeon, and an optometrist who can bring such amazing vision to people who are suffering from cataracts.
Yeah.
Well, I know Dr. Bruns will explain a lot more.
Yeah. Absolutely. Go ahead.
Yeah, sure. So, I mean, cataract surgery is kind of a rite of passage. You live old enough, you're going to get cataracts. And the way we're doing it in, 2024, it's a lot different than your grandma's cataract surgery back, in the 70s and 80s. We do it just so much more differently. There's a bit of an art to it. And we're really excited to have this technology here and available and be doing it so well in Milwaukee.
It's
awesome.
Pretty cool. What was your vision like beforehand? Because obviously your job, you need to see close up.
That's right. But it was actually a rather precipitous fall in my vision that I noticed over a few months.
Like quickly?
Relatively quickly. I mean, I knew my vision, that I had a little bit of a cataract problem, but my vision wasn't affected as much. I still needed readers and things like that, but I wasn't using glasses all the time till about a year ago. And then it seemed like I needed glasses all the time, and then it seemed like if I was driving at night, there was glare around headlights coming at me, and just kind of even in the daytime, the sun was too bright for me to see traffic lights.
Yeah.
And so I was very sensitized.
Yeah.
And getting scared. Okay,
yeah.
Is this cataracts or is this something else?
I get it. Why did you choose Summit Eye Care?
Actually, my dad was an ophthalmologist, my sister's an ophthalmologist, and so I researched what might be able to be done. I had astigmatism, and I never thought that I could have the ultra fancy corrective lenses that were being put in with after cataract surgery, intraocular lenses.
Yeah.
And so after I did some research and I checked out, not just with other patients, but also multiple websites of ophthalmology groups in town, spoke to another ophthalmology advertising person that I knew, and everybody was saying, go to Dr. Bruns.
Really?
Okay.
That's huge. Especially the fact that you have ophthalmologists in your family. You know, I mean, those are big praises then for you guys.
Yeah, we appreciate that.
Yeah. Tell us about the difference, because you've talked about this before between traditional cataract surgery and these light adjustable lenses, LAL lenses, that are these new sorts of lenses that Dr. Mangione had from you.
So the big difference is really a lifestyle choice. I mean, so traditional cataract surgery, we do a lot of that still, and we do it very, very well. Cataracts are a medical necessity, so you're going to improve your vision. The downside to the traditional method is you're probably going to need glasses. You'll need glasses for distance, glasses for reading. Most people end up with a bifocal or a progressive lens, and that's perfect for some people, but others who need, a little bit more tack sharp vision, they want to have the independence from glasses. Dr. Mangione, doing what you do and your lifestyle and your hobbies, trying to get out of glasses was appealing.
Yeah.
And so it's a lifestyle choice, and so we can do that.
One of the things I never realized until you guys started talking to us about this is that even after the surgery is done, further adjustments can be made. I had no idea.
That's why Dr. Bruns is such an expert, and why it's so fortunate that he's done thousands of these procedures, because there is an adjustment. You get to try out your lenses for 2 weeks, and then go back and they refract your vision to see where you are, and then start doing some adjustments.
Wow.
And you can make multiple adjustments.
Yeah, so there is this big variable in the healing process, and that's simply how the eye heals. We have a good idea, but there is variability there from patient to patient, and so we let that process happen. And in about 2 or 3 weeks, and we bring you back and we check your glasses prescription like we normally would, but instead of giving you a pair of glasses at that time, we can adjust the lens up to 3 times.
Wow.
And we can let you test drive it for a week or 2, or as long as you want, before adjusting it again.
One of the things that, to be honest, you seem fearless to me, but having surgery on my eyes seems a little bit scary.
I will tell you, for me, it was such an easy thing because I went in there And I knew so many of the nurses from operating rooms at St. Joseph's and other places. And I knew the anesthesiologist. It was like old home week.
Yeah.
It really was a very easy procedure. The surgery center is lovely. The people are very friendly. And it's seamless. I mean, you just go in and there's nothing really involved that should be scary at all.
Well, one of the things because my mom had cataract surgery, I talk about it a lot, and she had to have one done and then the other because she had traditional.
Right.
This is something you can do both eyes at the same time, and that's different for a lot of people too, right?
Yeah, and it's a convenience aspect.
Yeah.
So with traditional surgery, we like to use one eye to sort of see how we did.
Gauge it, right?
Yeah, gauge it, and then we use that to our advantage for the second eye. But with this, we're going to adjust them both anyways. So we do them both on the same day, and that just keeps things quicker.
My mom said the surgery is like nothing. She's like, she goes, I don't know what you're worried about. It's like nothing.
Yeah. Well, how was recovery?
Recovery was great. The problem is I would always start to reach for my glasses and then realize I don't need them.
Yeah.
Sit down in front of the computer. I'm like, where are my I can look at the computer. I can read it.
Do you need them now?
No, not at all.
You don't need them at
The
all?
only time I use my magnifying loops for my
work.
vein surgery and things like that, and other specific things. But no, I do not need glasses. I do not need readers. It is really life-changing.
Wow. And how
You
long has
feel
it been?
young again. The thing that makes you the oldest, as I aged, the thing I hated the most was having to wear glasses.
Me too.
You know?
Everybody's teasing me because I just turned the font up on my phone to a larger font.
Yes.
And everyone's like, why is your font so big? I was like, oh, I didn't.
Hey, I know a guy that can help you with that.
I know, it's true. And you can help other people too. It's not just cataracts. So a lot of people can come and see you, which I want to as well.
Yeah.
Thanks to both of you
Thanks,
so
you
much
guys.
for being here.
All right, if you're wondering if cataract surgery with LAL is right for you, or you just want more information, you've got to visit summitiwi.com. You can also call them. The phone number is 414-877-6414.